Our immune system is very important for fighting infections and cancers. However, we have to suppress the immune system in order to prevent rejection of the transplanted organs. Today we will discuss immunosuppressants and kidney transplants, understanding medications management. In this episode we will learn the details of immunosuppressive medications, exploring their vital role in preventing organ rejection after kidney transplantation, and the importance of medications management in ensuring transplant success. Welcome back to the Kidney Zone. I'm Dr. Mo. Before we begin, please remember that this video is for informational purpose only. If you have any concerns about your kidney health, it is important to consult with a healthcare professional or a kidney doctor. Let's start by discussing the role of immunosuppressants in kidney transplants. Kidney transplantation represents a life-saving intervention for individuals with end-stage kidney disease, offering promise for renewed health and freedom from dialysis. However, the body's immune system recognizes the transplanted kidney as a foreign tissue and mounts an immune response to reject it. Immunosuppressive medications play a crucial role in preventing rejection by suppressing the immune system's response and allowing the transplanted organ to function effectively. So what are the types of immunosuppressive medications? The first family is calcineurin inhibitors, or CNIs. These are such as tacrolimus and cyclosporin and are among the most commonly used and effective immunosuppressive medications in kidney transplantation. These medications work by inhibiting the activity of calcineurin, which is a protein that plays a role in immune cell activation. By suppressing the immune system function, CNIs also prevent rejection of the transplanted kidney. The second family is anti-proliferative agents or antimetabolites, such as mycophenolate and azathioprine. They work by inhibiting the proliferation of immune cells, particularly the T lymphocytes, and these medications help in prevent the immune system from mounting an aggressive response against the transplanted kidney. And this reduces the risk of rejections, of course. The third family, or the third main family, is corticosteroids, such as prednisone. These are very powerful anti-inflammatory medications that suppress the immune system's inflammatory response. In kidney transplantations, corticosteroids are often used in combination with other immunosuppressive agents to prevent rejection, and they manage the acute rejection episodes as well, but we give them in higher doses. So now let's move on to the medication management and compliance. Adherence to the treatment regimen is very important. Medication management is critical in ensuring the success of kidney transplantation. Transplant recipients must adhere to the prescribed treatment regimen, taking the immunosuppressive medications as directed by the healthcare providers. Skipping doses or discontinuing or stopping medication without medical guidance can increase the risk of rejection and compromise the graft survival. This is why monitoring and adjustment become very important. Regular monitoring of transplant recipients is essential for assessing medication efficacy, detecting the early signs of rejections or medication-related side effects, and making necessary adjustment to the treatment regimen. Healthcare providers closely monitor the blood levels of immunosuppressive medications and may adjust dosage based on individual responses and kidney function. Now, this is why it's very important to understand the side effects. Immunosuppressive medications can cause a range of side effects, including gastrointestinal disturbances, hypertension, diabetes, and increased susceptibility to infections, and also increased susceptibility to cancers. Transplant recipients must be very cautious in monitoring for potential side effects and promptly report any symptoms to their nephrologist or to their kidney doctors for evaluation and management. How about the long-term implications and risk management of immunosuppression medications? The long-term maintenance and kidney transplant recipients require long-term maintenance therapy in immunosuppressive medications to prevent rejection and maintain the graft function. Adherence to medication regimens, regularly follow-up care, and also lifestyle modifications are very important for optimizing the long-term outcomes. So what are the risks of complications? While immunosuppressive medications are vital for preventing rejection, they also carry a risk of complications including infections, malignancies or cancers, and metabolic disorders. Transplant recipients must work closely with their doctors to mitigate these risks through regular monitoring, and also preventive measurements such as vaccines or preventive testing. It's very important too that realize that there is individualized care. Medication management in kidney transplant is highly individualized. Not everyone is the same. Take into account factors such as age, comorbidities, medications, tolerability, and graft function. Kidney doctors collaborate with transplant recipients to tailor treatment regimens to their specific needs and optimize the outcomes and manage the complications effectively. So, in conclusion, understanding the role of immunosuppressive medications and medication management is paramount for the success of kidney transplantation. By adhering to the prescribed treatment regimens, monitoring for potential side effects, and actively participating in their care, transplant recipients can maximize the longevity and function of their transplanted kidneys. Immunosuppressive medications represent a cornerstone for kidney transplant therapy, offering their promise for renewed health and vitality for individuals facing end-stage kidney disease and kidney damage. If you found this video informative, don't forget to give it a thumbs up, subscribe to the channel, and leave us a review or rating in your favorite podcast platform. For more kidney health related content, please always follow this channel and always take care of your health. Stay hydrated, and thank you for tuning in for the Kidney Zone, and I'll see you in the next episode.